day, ladies and gentlemen. I know that a lot of male significant others, spouses, and boyfriends watch these videos, and I applaud you. Menopause is a state of affairs that affects everybody in one way or another. So welcome to the unit on cervical cancer. This is video number 345, which is the 6th video in the unit. As you know, each video builds on the foundation of the one before it, so let me orient you to where we are. In video number 342, I taught you about the site where over 90% of cervical cancers begin, the transformation zone. The transformation zone is the fine line right there separating the squamous skin cells of your cervix from the columnar glandular cells of your endometrium. So the medical term for this transformation zone is squamo-columnar junction. Then in video number 343, you learned that similar to endometrial uterine cancer, cervical cancer progresses through a parade of dysplasias before actually becoming cancer. Then, in video number 344, you learned that cervical cancer does not produce symptoms in the pre-cancer stage. And even when it does finally present symptoms, most women mistake them for something other than cervical cancer. And this absence of early symptoms calls for a screening test to detect abnormal cells early. So today we're going to discuss the screening test for finding abnormalities in these cervical cells before they become actual cancer. Now, I'm sure you think you already know everything there is to know about screening for cervical cancer. But I hope you know me well enough to know that you'll learn something you didn't know. That's my specialty, making you aware of what you didn't know. And since this information is not even in my book, either edition, you need to watch this video to enhance your knowledge on this particular subject. So you probably already know that the screening test for cervical cancer is the Pap smear. But let's back up a bit. Let's review the requirements of a screening test and then talk about how the Pap smear came about. In video number 314 on cancer assessment, I taught you about screening tests in general. Here's a review of that information. A screening test is a procedure that serves the purpose of detecting a disease in its early phase. In the case of cervical cancer, the goal of a screening test is to detect cellular changes in the pre-cancerous phase before they ever become cancer. In essence, you can think of a good screening test as a tool that pushes the diagnostic clock backward. It enables the diagnosis of abnormalities in the cells of your cervix 20 years earlier than they would present with clinical symptoms of cancer. In order to be acceptable, a screening test must serve the public at large rather than the individual patient, be inexpensive, be simple and accessible, be useful when the cancer is asymptomatic, early or precancerous, focus on the possibility of cancer rather than the actual presence of cancer. One of the features of a screening test is to lean toward over-diagnosis rather than under-diagnosis. That means there will be some false positives in which the screening test predicts a high likelihood of cancer when you don't really have the cancer. It's akin to fake news. Another word for this is sensitivity. Sensitivity is the tendency to overestimate the presence of cancer. And the reason a screening test errs on the side of being too sensitive is that it's better than missing cancers that are actually there. So the familiar Pap smear is the screening test for cervical cancer. But I want to tell you a bit about the history of the Pap smear. It's interesting. The word Pap is really an abbreviation of the last name of the man who invented the Pap smear. In the early to mid-1900s, cervical cancer was a very common disease. A woman would start having all sorts of symptoms that no doctor could diagnose as anything verifiable. Unlike cancers in accessible regions of your body that produce visible or palpable lumps or bumps, the cervix is a hidden, private place that people did not discuss in those days. Mention of anything related to one's genitals was taboo. And since women could not see their cervices, they did not know they had a cervix so that they could develop cancer there. In 1908, a physician by the name of Walter Schauenstein distinguished the appearance of normal cervix from an abnormal cervix by means of a pelvic exam. And then, in 1920, a man by the name of Hans Hinzelmann invented a microscope for looking at the cervix. It was called a colposcope. It was just a low-power microscope on a flexible stick, but it did magnify the surface of the cervix a bit. But the problem at the time was that doctors were male and women were modest. In order to examine the cervix with a colposcope, a woman had to undress, lie on her back, spread her legs, and rest her feet in cold metal stirrups. The other problem was that the doctors of the day were unconvinced of the value of looking at the cervix. Then, in 1928, a Greek-American researcher named George Papanikolaou discovered that cells on the surface of a cervix fell off easily merely by swabbing them. This makes sense. The cells on the surface of the cervix are skin cells, remember? All your cells are constantly sloughing off your skin. So the skin cells on the surface of your cervix that is exposed to your vagina and therefore to the outside world are no different. When George Papanikolaou examined cervical cells under an actual microscope, he discovered that normal cells were organized and predictable in their appearance, whereas cancer cells were disorganized and unpredictable in their appearance. By 1930, George Papanikolaou promoted examination of cells swabbed from the cervix as a means of taking a snapshot of what was going on in the cervix. But the medical community rejected his findings. Nevertheless, throughout the 1930s, George Papanikolaou tested the same women sequentially and saw that the progressive changes toward and into cancer were obvious. And he called the test a pap smear, which was an abbreviated form of George Papanikolaou's last name. And since the medical community had rejected his work, he started training medical technicians to distinguish normal cells from abnormal cells. Then, he showed that removing the abnormal cells prevented cervical cancer. Well, this of course caused a stir in the medical community, and suddenly doctors were interested. Until the 1940s, doctors practiced medicine privately. There were no guidelines, and there were no scientific studies on the effectiveness of different methods of practicing medicine. So when Papanikolaou proposed that medical technicians could read and interpret cervical cells under a microscope, doctors pushed back because they did not want to give up control of managing cervical cancer. Gynecologic surgeons did not believe that removing merely a segment of the cervix was as effective as performing a total hysterectomy. The fact that medical technologists could read slides and erase the need for total hysterectomies threatened gynecologic surgeons. So this controversy persisted throughout the 1950s. And this was still a time when women were ashamed of their sexuality and resisted allowing a man other than their husband, even a doctor, to see their genitals. But this was precisely what this anti-cancer effort of getting a pap smear told them to do. The cancer societies were on the sides of doctors, so they provided training programs for doctors only. And by the early 1950s, there were still just very few doctors who knew how to assess cervical smears. And while all these controversies brewed, 1 out of every 100,000 women died of cervical cancer each year. But in Canada, a physician named Arthur Boyes went outside the medical system and used independent labs to read cervical smears. And then he showed that this form of screening saved lives, which resulted in a Canadian government program for the early detection of cervical cancer. And within 3 decades, the soaring cervical cancer rates stabilized and then dropped by 1/3 in Canada. The United States and Great Britain remained opposed to cervical cancer screening. They even opposed patient education on the matter. So, cervical cancer rates continued to rise in those countries. In 1957, the American Cancer Society finally launched an effort to promote screening for cervical cancer, 15 years after Papa Nikolau's test had shown it saved lives, and 30 years after it was first developed. By that time, the evidence in its favor was overwhelming. But it wasn't until 1988 that Great Britain offered regular screening for cervical cancer, and when it did, new cases of cervical cancer fell by 1/3 there too. By 1978, the number of deaths from cervical cancer was greatly reduced. In countries with national screening programs, rates of cervical cancer had plummeted to 1/4 of what they had been before screening, and deaths dropped by 50%. So despite the fact that the Pap smear eventually came to be very successful, it was really held hostage for years after it was shown to save lives. So this success story of the Pap smear as a screening test for cervical cancer is legendary, but few people know all the details. Ultimately, it's what we strive to achieve with all screening tests. Hopefully, all of them won't have the time frame and impediments along the way, because the Pap really was a zap to cervical cancer. The Pap smear meets all the requirements for a screening test. It serves the public at large rather than the individual patient. It's inexpensive. It's simple and accessible. It's useful when the cancer is early and asymptomatic or precancerous. And it focuses on the possibility of cancer rather than on the actual presence of cancer. Not only that, it's also quick, painless, and non-invasive. So it really did change the face of cervical cancer forever worldwide. I guess you could say that the Pap practically took cervical cancer off the map. So, guidelines were developed to have annual Paps, and you probably had annual Paps most of your adult life. And that is probably why you hardly ever hear of anyone getting cervical cancer. Instead of getting cervical cancer, women who have abnormal Paps get treatment of the pre-cancerous cervical lesions long before they ever become cancer. You might be one of those women. And I'll talk more about the diagnosis and treatment of abnormal Paps in a later video. Now, guidelines change all the time. And the guidelines for Pap smears are in a big state of flux. There are Pap guidelines for once every year, and there are others for once every 3 years. There are differences in the age at which you should start getting Paps and the age at which you should stop getting Paps, if ever. But just know that there are different guidelines. I'm a big believer in peace of mind. Given the fact you can't see or assess your own cervix, get Paps according to whatever schedule gives you peace of mind. Now, performing a Pap is really easy. I mean, sure, you have to undress, lie on a table, spread your legs, and put your feet in cold metal stirrups unless your doctor is thoughtful enough to cover the stirrups with warm, fuzzy footies. But your doctor merely inserts a speculum, which is this instrument, into your vagina, and what it does is it separates the walls of your vagina. So, if I take this speculum and I put it in this vagina, I can then adjust it so that it will separate the walls of the vagina. And in so doing, as I look in there, I can see the cervix at the top of your vagina. That's how the doctor actually sees your cervix to get the pap. Now, the instrumentation for collecting the actual specimen used to be this wooden or plastic spatula. And I'm going to take the speculum out because it's easier to see what's going on when I do. But the doctor takes the spatula and just inserts it into the vagina all the way up to the cervix and just scrapes the opening of your cervix with the spatula to get cervical cells. And this shape makes it easy to do so. And then this spatula is just rubbed on a microscope slide and sent off to the pathologist. Nowadays, it's more common for the doctor to use a brush. And a brush is nicer and easier because the transformation zone is really inside the hole of your cervix. And a brush actually goes into the hole and collects cells in the hole better than the spatula does. So your doctor merely inserts the brush into the opening of your cervix, twists it once or twice, and then takes the brush out and inserts it into a test tube that contains a solution. Either way, it takes only about 5 seconds to perform the pap smear. And then your doctor just sends the cells to the pathology lab for evaluation under a microscope. And the pathologist looks under the microscope and delivers a report on how the cells look microscopically. This has been a routine part of an annual pelvic exam for as long as most of us can remember. But now, things are changing. And I'm going to wait and tell you why they're changing in the next video. So the summary for today is that the pap smear was a true success story as a screening test for cervical cancer. It detected early changes in cells before they became cancer cells, and it enabled treatment to avoid cervical cancer and death. Don't you just love a great success story like this? I like to tell you the history of things that are interesting, and I find this kind of thing fascinating. And you know, history really does repeat itself. So you learn a whole lot by learning history. Actually, I think it's more accurate to say, know your history or you'll repeat it, because in most cases, history teaches you what to avoid as much or more so than it teaches you what to do. So this is where I'll leave you today. If you need me for anything at all, please schedule a consultation at menopausetailor.me. I will be delighted to help you. If you like social media, please follow me on Facebook, Twitter, Pinterest, and Instagram. And if you'd like a subscription to this channel, click the subscribe button. And if you'd like a subscription to my newsletter, provide your email address. I will tell you goodbye for now. Bye.